everyone. My name is Sean. As you can tell from my accent, I'm from London in the UK. Whoop, whoop. The reason I decided to make this video about my BA or breast augmentation was because I did a lot of research and I watched a lot of women's videos about them possibly getting a BA, or they've had it, or their mum's post-op, which I think is fabulous, and I basically wanted to give it a go. And secondly, that whilst watching the videos, I haven't seen anybody from the UK do one. Everybody's from America, and so I wanted to kind of champion the London side of things. So yeah, that's kind of why I'm making the video, and to obviously inspire other women who are thinking of getting it done, so they have the right information, because this is a life-changing thing that we are all about to go through, or we're thinking of going through, and I think that everybody should know exactly what's going on, I think. So a little bit about me and why I decided to go through with it, or what I was thinking of. I've been wanting to have bigger boobs probably since I was about 14. I told my mother at 16 that this is something that I'm really serious about doing, and of course, me being 16, she was a little bit shocked, but she took me to the doctor anyway, my local GP, and with her, and my doctor said that because I'm 16, I still have room to grow and to get bigger, so basically be patient, hold tight, and just see what happens. I got to 18 and nothing happened, nothing got bigger, I'm still exactly the same size, and I thought, okay, this is something that I definitely want to do. I just pretty much need to have the finance to do it. That was the only thing that was really stopping me. So now I'm 22, going to be 23 in a month. Whoop, whoop. And yeah, I have the money to do it, so I'm going to do it. I've put my deposit down already, and I'm getting it done on the 2nd of July 2014. I am extremely excited. It feels like Christmas and my birthday presents at once. So yeah, oh, let me continue with who I actually went with. I went with a doctor called Naveen Cavale. He works for the NHS, and he also works for the Cavendish Clinic, which is where I went to. I went to see about 5 other people before I saw him, or maybe it was 4. Yeah, so I'll list them. So the first person that I went to see for a consultation was Dr. Russo with the hospital group. I thought he was good. He's done a hell of a lot of surgeries before. I think it was 7,000 or something ridiculous like that, which I guess is great for him. He does a lot of celebrities, but he wanted me to go to a size which for me I didn't feel completely comfortable with going. Obviously I want bigger boobs, but I don't want to look like a Barbie. I still want to look like myself, but just with a nice rack, I guess. So the size that he recommended for me was 265cc. And when I took pictures in it, I thought, okay, I actually look quite big, but it's okay. But now when I looked back, this is about maybe about 5 days later, I thought, they're a little bit too big. So yeah, I just didn't really feel 100% comfortable, as much as they have really good benefits and the pricing was okay. It just didn't feel right with me. So that was Dr. Russo from the hospital group. I then went to Harley Medical Group, or Harley Street Clinic, one of them. Harley Medical, yeah, one of them. I think it was Harley Medical Clinic, I think, yes. I think that's number 6 Harley Street in London. I went there, I spoke to a patient advisor, not a surgeon. I think it makes a very huge difference because you want to kind of know what the surgeon thinks. You don't really want to speak to somebody who kind of guesses what you want. I went there, and yeah, she was okay and telling me everything, but they had like a lack of surgeons, or if they did have surgeons, that it would take a long time for me to see them, and I'm adamant that I want my surgery at the beginning of July, so I had to let them go. I went to see Maya, or MYA, or Make Yourself Amazing. Yeah, I went in there, all the girls are dressed up, everybody's in black, everybody is in 6-inch heels. It's all very glamorous, it's very pink, so I completely understand why people would feel, or women would feel, a little bit more secure with going there. I spoke to somebody there. It was okay too, I really liked her, and the pricing was good too. Sorry, if I go back and talk about the pricing, the lowest price I've had, or that I've been quoted, is £4,050. I'm not sure what that is in dollars. And the highest I've been quoted was £4,595. So it's a tiny little bit of a difference, like 500 quid in it, or maybe a couple of pounds in it, or whatnot. So I guess if price is an issue, then do really consider who you're going with. But for me, I don't mind paying for the best result, because I believe that's important. So who have I gone through? So we've gone through the hospital group with Dr. Russo, we've done the Harley Medical Clinic, we've just done MYA, which I really liked. Who else did I go to see? I went to the Cardonic Clinic, which is around Silicone Square. I didn't like it. I'm going to be straight up and I'm going to be honest. It just felt very, very cold when I walked in. I'm a big believer of feeling, of feeling energy and being in the right place at the right time. And when I walked in there, it felt quite cold. Not in terms of the temperature, but just in the feeling that I had with the people there. The woman who I spoke to, she was very blasé about, I love that word, she was very blasé about the procedure, or how it actually works. Like when I was asking her about what kind of stitches they use, or whereabouts the implant will be put in, like whether it's underneath the arm, or in the crease of the breast, or through the nipple, or through the tummy button. She just didn't really know what she was talking about. She was just like, oh, you have to speak to the surgeon and whatever. So she didn't really help me out that much. So I didn't really want to go with them at all. But funny enough, lucky number, I think that's number 5 now. So I went to Cavendish Clinic, and I met my doctor, and he made me feel welcome. My choice pretty much came down to gut instinct. So the implants, when I told him that I was recommended to have a 265cc, he was outraged. He says, I will not put them in your body because they will not go with what you want, and they will look fake, and I want the most natural boobs ever. So yeah, he said he wasn't going to do that. So he got me up, he checked my boobs out, and he told me where most of the tissue is and where it isn't, and where he wants to put the implant in. So the implant is going to be put in the crease, so underneath the crease of the breast, and I have a scar which is about 3 inches? Yeah, about 3 inches long. I think it's 3 inches or 3 centimeters. I don't know. Sorry, this is so awful. Between 3 and 5, basically. But mine would be quite small. Be put underneath the muscle. He works with silicone implants. They're called naturelles. I tried on the 210cc. Yeah, so as you can see, there's not much there. I've been told I'm a 32A. I doubt it. I'm probably like 32 triple minus A, whatever that is. So yeah, there's not much there. It's just this. This is me side view. Oh, there it is. And that's me. So back to the sizing of my implants. So I tried on the 210 and it just looked like me in the padded bra, which is about a 32A padded bra. So I definitely wanted something a little bit bigger. So I tried the 220 and I was automatically satisfied. They look natural, but they still look really nice on my body because I've got a really small frame. So I just think they'd be great for me. So I've decided to go with 220 silicone naturelle implants underneath the muscle, through the crease of the breast. That's kind of it really. So my surgery is on the 2nd of July. I'm definitely going to have another update before my surgery so I can go through all of the questions that you may want to ask me, if you want to ask me anything about my thoughts or what I'm scared of, or just the risks and precautions, just anything really. I'm so open, so please just leave a comment below if you want me to answer anything. And yeah, I'm so excited. So I guess I will talk to all of you guys a little bit later, probably around June time, where I'll have my pre-op sort of blood test and all that stuff, and then I'll be away. So yeah, let's give it a go. So all of you have a really cool day and I will speak to you soon. See ya.